Developing Good Eats, a multi-strategy intervention for improving healthy food intake for high school age students in Baltimore, Maryland. This presentation was designed to provide you with an overview of how I developed a strategic plan to address and prevent obesity while increasing healthy eating habits among high school age students. There were several steps involved in the process, which included selecting a target audience and a health concern, researching and exploring the health behaviors of the population, identifying and proposing policies that would address the unhealthy behaviors, brainstorming equitable solutions and strategies that support health and health conditions, implementing strategies to address the behaviors using interventions that would also engage the population. The end result in this case is Good Eats, a multi-strategy intervention for improving healthy food intake for high school students in Baltimore. My strategic plan addresses obesity prevention among high school aged adolescents in Baltimore, Maryland. During this portion of the planning process, I familiarized myself with the needs of my student population, and I viewed this statistically from a national, state, and a local level. I also considered social determinants and other influences that influence their health. I explored the food habits and eating behaviors of the demographic, and studies indicate that high school age students do not consume an adequate amount of fruits and vegetables daily, nor do they get an adequate amount of physical activity. Research shows that high school age students consume an excess amount of sugar and fat by way of fast food and sugar sweetened beverages and snacks, which contribute to the obesity rates. Policies are needed to create the standard, an equal base, the minimum. In this case, I made two policy recommendations: having food nutrition facts displayed in the cafeteria for public viewing, and also a recommendation for adequate time to receive and consume meals. The stakeholders involved in both policies would include the students, teachers, PTA members, Board of Education, the local community members, and any other school visitors. So after and getting to know, reviewing the policies, suggesting a policy, and getting to know the individuals who I will be working for, I then had to consider their perception, their environment, the social determinants, and all the other factors that have influenced their behaviors and health outcomes. This initiative will use constructs from the Information Motivation Behavior Skills Model, the Health Belief Model, as well as constructs from the Social Cognitive Theory to target and address psychosocial and environmental determinants associated with the health concern of obesity. And as you can see here, I have a copy of the models, the Health Belief Model, and then the Social Cognitive Theory. And finally, we're at the program. From theory to practice, Good Eats is a 90-day multi-level, multi-strategy approach to increase access to, demand for, and consumption of healthy foods. It will launch in Baltimore City Public Schools, and the campaign will be offered in partnership with the school system. Strategies for the program include an after-school program which teaches children about nutrition and engages them in hands-on learning opportunities in the kitchen. We engage the population by raising awareness through health communication, through social activities, such as our Good Eats after-school program for teens. Also, in place is an environmental change strategy which includes a salad bar and station in the cafeteria in the school environment. It's also important to consider the expenses associated with making all of these changes and consider any budget restraints. This is just some pictures of what the finished product of the program and policy would look like. And here are my references. Thank you for watching.